Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Dr. Williams. I've been experiencing some troubling symptoms lately and need your guidance.
Of course, Mr. Lee. Let's get to the bottom of this. Could you describe your symptoms?
I've been having persistent chest pain and shortness of breath, especially when I'm walking or doing any kind of activity. It's been happening more frequently over the past few weeks.
That's definitely concerning. Is the chest pain sharp, dull, or does it feel tight?
It's mostly a tight, squeezing sensation. Sometimes it radiates to my left arm and jaw.
I see. Have you noticed any other symptoms like dizziness, fatigue, or swelling in your legs?
Yes, I've been feeling unusually tired and my ankles have started to swell by the end of the day.
Have you ever been diagnosed with heart disease or high blood pressure?
I was diagnosed with high blood pressure a few years ago, but I haven't been taking my medications regularly.
It's crucial to manage high blood pressure as it can lead to more serious conditions. Have you noticed any other symptoms like nausea or excessive sweating?
Occasionally, I feel nauseous, especially during or after the episodes of chest pain.
Based on what you've described, I suspect we might be dealing with angina, which could be a sign of underlying coronary artery disease. The swelling in your ankles and fatigue could indicate heart failure.
That sounds serious. What should I do?
The first step is to confirm the diagnosis. I'd like to order an electrocardiogram and a stress test to assess the heart's function. We should also get blood tests to check your cholesterol levels and other indicators.
All right, and what happens after that?
If the tests indicate heart disease, we'll need to start a treatment plan immediately. This might involve medications like nitrates for chest pain, beta blockers to reduce the heart's workload, and possibly statins to lower cholesterol.
And what about the heart failure symptoms?
For heart failure, medications like diuretics can help reduce fluid buildup, and ACE inhibitors can help the heart pump more efficiently. We may also consider lifestyle changes, like reducing salt intake, exercising carefully, and managing your weight.
That makes sense. Are there any side effects I should be aware of with these medications?
Each medication has its own set of potential side effects. For instance, nitrates can cause headaches and dizziness, while beta blockers might cause fatigue or cold extremities. Diuretics can lead to electrolyte imbalances. We'll carefully monitor you to minimize any adverse effects.
I understand. Are there any lifestyle changes I can make to help?
Yes, it's important to follow a heart-healthy diet, which includes reducing salt and saturated fats. Regular moderate exercise like walking can also be beneficial. Stress management is crucial too, as stress can exacerbate heart conditions.
I'll start making those changes. When should I return for follow-up?
Let's schedule a follow-up in a month, but if your symptoms worsen or you have any new symptoms, come back immediately or go to the emergency room.
Thank you, Dr. Williams. I'll do my best to follow the plan.
You're welcome, Mr. Lee. We'll work together to improve your heart health.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. I'm feeling quite unwell and have been experiencing significant fatigue, abdominal pain, and frequent diarrhea for the last few months. My appetite has also decreased drastically, and I've lost almost 15 pounds in this period.
I'm sorry to hear that. Let's dive into your symptoms a bit more. How long have you been experiencing these symptoms, and is there anything that triggers them?
It's been about 5 months now, and I notice the pain worsens after meals, especially when I consume dairy products or gluten. Sometimes the diarrhea is accompanied by blood.
Have you noticed any other symptoms, such as skin rashes, mouth sores, or joint pain?
Yes, actually. I've had recurring mouth sores and occasional joint pain, mostly in my knees.
I'm concerned about your weight loss and gastrointestinal symptoms. Have you had any previous conditions related to your digestive system?
No, not that I know of. I've had stomach bugs before, but nothing lasting this long or this severe.
Are you taking any medications, and do you have any known allergies?
I'm not on any medication currently and have no known allergies.
Do you have a family history of digestive disorders or autoimmune diseases?
My uncle had Crohn's disease, and my mother has rheumatoid arthritis.
Given your symptoms and family history, we conducted a series of tests, including blood work and a colonoscopy, to rule out conditions like Crohn's disease or ulcerative colitis. I also recommended testing for celiac disease due to your reported sensitivity to gluten. The colonoscopy results show signs of inflammation in your intestines and some ulcerations. The blood tests also reveal a slight increase in inflammatory markers, which is consistent with Crohn's disease. The biopsy results confirm the diagnosis. Additionally, the tests for celiac disease came back positive.
So I have both Crohn's disease and celiac disease.
Yes, it appears so. This combination explains your symptoms well. We'll start by treating the inflammation in your intestines. I'll prescribe a course of corticosteroids to reduce inflammation and an immunosuppressant to manage Crohn's disease long-term. For celiac disease, the primary treatment is a strict gluten-free diet.
That sounds like a lot. What should I expect with these treatments?
You may initially experience some side effects from the steroids, such as mood changes or weight gain. However, once inflammation is under control, we'll aim to taper them down. Immunosuppressants have potential side effects like increased infection risk, so we'll monitor you closely.
And the gluten-free diet? Is that really necessary?
Yes, it's crucial to managing celiac disease. Even a small amount of gluten can cause damage to your intestines. We'll provide you with resources to help you transition to a gluten-free lifestyle, including dietary plans and support groups.
All right, I'll give it a try. Is there anything else I should do?
It's important to avoid foods that exacerbate your Crohn's symptoms, such as dairy or high-fiber foods during flare-ups. Staying hydrated, managing stress, and regular follow-up appointments will be essential to your care.
Thank you, doctor. I'll make the necessary changes and see you in the follow-up.
You're welcome. Take care, and don't hesitate to reach out if you have any questions or concerns before our next appointment.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Lately, I've been trying to keep my blood pressure in check, but sometimes it spikes unexpectedly.
Blood pressure can fluctuate due to various factors like stress, diet, or medication adherence. Have you noticed any particular triggers?
I've noticed stress and salty foods seem to have a significant impact.
That makes sense. Both stress and salt can elevate blood pressure. How do you handle these situations?
I try to limit salty foods, but managing stress is challenging, especially with my workload.
It can be tough to manage, but staying disciplined is crucial. Have you considered relaxation techniques or seeking advice from a dietitian?
No, but those sound like good options. Could you guide me on this?
Absolutely. We can refer you to a dietitian for personalized guidance on reducing salt intake, and a counselor can help with stress management strategies.
Thank you, doctor. I'll follow up on that.
You're welcome. Taking these steps will help you manage your cardiovascular health better. Let me know if you have any questions.
Now look at question 26.
Immunizations play a critical role in preventing infectious diseases, especially in children. Have you kept up with your child's vaccination schedule?
We try to, but with our busy schedules, we miss the last appointment.
It's understandable, but it's important to keep up with the schedule to ensure your child is protected. Do you need assistance scheduling a new appointment?
Yes, that would be helpful.
No problem. I can help you arrange that. Are you aware of the vaccines your child needs?
Not exactly, but I'd like to know more.
I can provide you with a detailed schedule of the recommended vaccines. It's important to stay on track, as each vaccine helps protect against different diseases.
Thanks for the information. I'll make sure to get my child vaccinated.
You're welcome. Vaccinations are crucial for your child's health. Feel free to reach out if you have any questions or need more information.
Now look at question 27.
Good morning, Sarah. I'm here to check on you. How are you feeling after that nebulizer session?
I'm feeling a bit better, but still a bit tired and agitated.
That's understandable. I see you're on a prednisone course, and your peak flow readings have improved slightly. Your oxygen saturation was at 92% after the last round of albuterol. Let's keep monitoring that.
Yeah, I really hope I keep getting better.
We'll do everything we can to help with that. Also, remember your spirometry test is scheduled for tomorrow at 11. Make sure to take it easy today and stay hydrated.
Got it, and I'll try to stay calm during the nebulizer sessions, but it's not easy.
I understand, Sarah. I'll make sure we're there to support you during those sessions. By the way, there's a patient coming in from surgery for post-op monitoring. He'll be in room 402, so it might get a bit busy.
Sounds complex. I'll do my best to help out where I can.
Now look at question 28.
I have a few questions about the echocardiography procedure. Can you tell me more about what it involves?
Of course. Echocardiography, often called an echo test, is a non-invasive procedure that uses sound waves to produce detailed images of the heart.
That sounds impressive. What kind of information can we get from it?
It's remarkable. We can see real-time moving images of the beating heart, which allows us to assess the heart valves, blood flow, and the size and shape of the heart chambers.
That's a lot of information. How can it help with diagnosis?
It's invaluable for diagnosing conditions like valve disorders, heart failure, and congenital heart defects. The images give us insights into the heart's function and structure.
Is it safe for everyone?
Yes, it doesn't use radiation, so it's safe for all patients, including pregnant women. If you ever need an assessment of your heart's health, an echo test is one of the best initial diagnostic tools.
Thanks for the info. It's good to know how comprehensive and safe this test is.
Now look at question 29.
The stress levels among our team have been rising steadily. We need a better approach to support our colleagues' mental health.
I agree. A lot of us have been feeling burnt out, especially after the recent surge in patient admissions.
What do you think about starting a peer support program or arranging group counseling sessions? It could help the team talk through their experiences and find coping strategies.
That sounds like a good idea. If we could get management on board, we might even be able to allocate some resources to it.
Yes, having a structured program would be beneficial. I'll draft a proposal and see if we can get it moving.
Now look at question 30.
We've been noticing gaps in the knowledge of some of our newer nurses regarding emergency procedures.
Yes, I've observed that too. We should consider setting up a series of workshops to refresh and update their training.
Agreed. We could focus on things like CPR, advanced wound care, and patient triage to ensure everyone is up to date.
It would also help to develop a mentorship program where experienced staff can guide the newer nurses through hands-on practice.
Great idea. I'll reach out to our education department to see how we can get this started.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
We are here today with Dr. Stephanie Hughes, a renowned specialist in cardiovascular health and the Chief of Cardiology at New York Medical Center. Dr. Hughes, can you help our audience understand why heart health is so important?
Cardiovascular diseases, or CVDs, are the leading cause of death worldwide. They claim millions of lives each year, often silently. Keeping our hearts healthy isn't just about preventing heart attacks, but also about maintaining overall well-being. From high blood pressure to heart failure, the spectrum of heart diseases can severely impact one's quality of life. This makes it crucial for everyone, regardless of age, to understand and manage their cardiovascular health.
What inspired you to focus on cardiovascular health?
During my residency, I had a mentor who was a brilliant cardiologist. His passion for the field was infectious. But what truly cemented my interest was my experience treating a young mother who had a heart attack. She had no significant risk factors and no apparent symptoms before her event. Her determination to recover and raise her children was inspiring. Witnessing how much of a difference early intervention made in her life, I was motivated to dedicate my career to understanding and preventing heart disease.
For those not familiar with the topic, what does maintaining heart health entail?
Maintaining heart health revolves around several key factors: a balanced diet, regular exercise, avoiding smoking, and managing stress. It's also vital to keep an eye on blood pressure, cholesterol levels, and blood sugar, as these are significant indicators of cardiovascular health. Regular checkup with healthcare professionals can help identify risks early and manage them effectively. Lifestyle changes can play a massive role in prevention, sometimes even more than medication.
Could you share a memorable case that had an impact on you?
One case that stands out is a woman named Clara, who was in her early 40s. She came to us after experiencing severe chest pain, which turned out to be a heart attack. Her initial tests showed that she had been living with undiagnosed high blood pressure for years, which had weakened her heart. We immediately provided emergency care and followed up with lifestyle changes and medication. Over time, Clara transformed her lifestyle completely, losing weight, eating healthier, and staying active. Her recovery was remarkable, and today she's a strong advocate for heart health awareness, sharing her story with others to encourage early detection.
What do you find most rewarding in your work with heart disease patients?
The most rewarding aspect is seeing patients regain their health and reclaim their lives. The heart is such a vital organ, and when it falters, it can cast a shadow over one's entire life. Helping patients make lifestyle changes and seeing them recover, sometimes from dire conditions, is incredibly fulfilling. Educating patients about the importance of heart health and seeing them apply that knowledge to improve their lives is also a significant motivator.
Where do you see the future of cardiovascular health headed?
The future of cardiovascular health looks promising, with advancements in medical technology paving the way for early detection and more effective treatments. We're seeing the rise of wearable tech that can monitor heart health in real time, providing invaluable data for early diagnosis. Personalized medicine is also becoming more prevalent, allowing treatments to be tailored to individual genetic profiles. Public awareness about heart health is increasing, and I foresee a world where heart disease becomes far more manageable due to improved lifestyles and medical care. This trajectory gives hope that we can significantly reduce the global impact of cardiovascular diseases in the years to come.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
In today's segment, we dive deep into a critical yet often overlooked aspect of mental health, the long-term effects of untreated anxiety disorders. Although the prevalence of anxiety has steadily risen in recent years, many individuals still do not receive the care they need. With us today to shed light on this pressing issue is Dr. Sarah Martinez, a clinical psychologist and researcher from Stanford University who specializes in anxiety disorders and their impact on individuals and society. Welcome, Dr. Martinez.
Thank you for having me.
Dr. Martinez, you've been a guest on our show several times to discuss mental health topics. Today, we are focusing on anxiety disorders. Could you start by explaining why untreated anxiety is such a significant concern?
Certainly. Anxiety disorders are incredibly prevalent, affecting millions of people globally. Yet many individuals don't receive proper treatment due to various factors, such as stigma, lack of awareness, or access to mental health services. The long-term effects of untreated anxiety can be devastating, affecting every aspect of a person's life, including their physical health, relationships, and productivity.
Can you elaborate on the physical health implications of untreated anxiety?
Absolutely. Untreated anxiety can lead to chronic stress, which has been linked to a range of physical health issues. For instance, prolonged stress can suppress the immune system, making individuals more susceptible to infections and illnesses. It also puts undue strain on the cardiovascular system, increasing the risk of heart disease and hypertension. Additionally, there is evidence to suggest that chronic anxiety can exacerbate existing health conditions, such as diabetes and respiratory disorders.
What about the psychological effects of untreated anxiety?
From a psychological perspective, untreated anxiety can lead to a downward spiral of worsening symptoms. Individuals may experience persistent worry, restlessness, and irritability that gradually interfere with daily life. This can lead to social isolation, as individuals avoid situations that trigger their anxiety. Over time, untreated anxiety can also lead to comorbid conditions such as depression, substance abuse, and even suicidal ideation.
You mentioned the impact of untreated anxiety on relationships. How does this manifest?
Anxiety can put a significant strain on personal and professional relationships. Individuals with untreated anxiety may struggle with communication, often avoiding conversations about their feelings due to fear of being misunderstood or judged. This can lead to a breakdown in trust and intimacy with partners, friends, or family members. In the workplace, anxiety can impair job performance and contribute to absenteeism, which strains professional relationships and may hinder career advancement.
So what is being done to improve the treatment and management of anxiety disorders?
The mental health field has made significant strides in recent years. Cognitive behavioral therapy, CBT, remains one of the most effective treatments for anxiety disorders. CBT works by helping people identify and change negative thought patterns and behaviors that contribute to their anxiety. There are also various medications that can help manage symptoms. Beyond traditional methods, technology has expanded access to care through teletherapy and mental health apps. However, barriers like stigma, access, and affordability still exist, emphasizing the need for continued advocacy and improved public health strategies.
How can individuals struggling with untreated anxiety take the first step towards getting help?
Acknowledging the problem is the first step. Individuals should reach out to a healthcare provider or mental health professional who can provide a proper diagnosis and treatment plan. Additionally, support from loved ones can be crucial. Encouraging conversations around mental health, educating oneself, and understanding that treatment is not a sign of weakness, but a path to recovery are all important.
Thank you for sharing your insights, Dr. Martinez. Your expertise is invaluable in helping us understand the complexity of untreated anxiety disorders.
Thank you for having me. Raising awareness and promoting understanding are key steps towards better mental health for all.